Longani Clinic's YouTube channel welcomes all of you. Today we are going to see the relationship between homeopathic materia medica, organon and repertory. Anything on our earth is stabilized with strong basement. Similarly, homeopathic medical system is stabilized by three pillars: materia medica, organon and repertory. Each of these pillars has its own importance. They are so intimately related to each other that the whole system remains incomplete if any one of these three pillars is not adequately understood. They form the strong framework for the system. Each of these plays and bears an inevitable role, and the system becomes imbalanced in the absence of any of these three. They are interdependent, complementary to each other, and inseparable parts of a whole. As it is rightly mentioned that homeopathy is compared with a bird, its body represented by the materia medica, wings by organon, and the tail which gives the correct direction by the repertory. So it is easily inferred that these three important branches of homeopathy are inseparable. For instance, they can be compared to a large tree where the roots are organon, which forms the strong basement for the tree. Homeopathic philosophy forms a sound basement to the system. The shoot of the tree is materia medica, and the leaves are the repertory, which are formed from the shoot. Here, materia medica. The fruit of the tree are simillimum, which are formed as a result of harmonious function of root, shoot, and leaves. Improper function of these will not give us a good fruit. Similarly, lack of knowledge in any of these won't give us an exact simillimum. For complete harmony, it is necessary that all the organs work in integration and properly. If one wants to derive maximum benefit from the system, it would be imperative to know all three pillars, repertory, organon and materia medica separately as well as completely. These have to be learned in stages. Now we will see the first one is homeopathic materia medica. Homeopathic materia medica is the collection of systematically recorded homeopathic medicines which are proved in healthy human beings of both sexes and different ages. Homeopathic materia medica is symptom register obtained from the drug proving on healthy human being. There are approximately more than 400 books on materia medica in English as well as in other languages. Homeopathic materia medica is a branch of science concerned with the study of homeopathic drugs used in the treatment of patients. In short, homeopathic materia medica is full of information about the medicine in detail. Now the second branch, which is the Organon. Organon of Medicine is a book written by Dr. Samuel Hahnemann in German language. Organon of Medicine contains set of rules established by Dr. Hahnemann for the guidance of the theoretical and practical methods to apply medicine written in homeopathic materia medica. There are 6 editions of Organon written by our master Dr. Hahnemann. Organon of Medicine also contains the guidelines and preparation and application of homeopathic drug substance. The pharmacological concept like selection of dose and potency, susceptibility, minimum dose, law of simplex and introduction to 50 millismol scale are covered in Organon of Medicine. The third one is a repertory. Repertory is an index of symptoms of the homeopathic Materia Medica with their corresponding medicines given in gradation and arranged systematically, or repertory is an index of homeopathic Materia Medica which is full of information collected from toxicology, drug proving and clinical experiences. The process of reperturization is essentially an elimination which starts with a broader choice and slowly narrows down the field, giving us small group of adequate medicines so that the final selection is made easier with the help of further reference to the Materia Medica. Homeopathic system has got a strong framework formed by these three disciplines. It is hard to reach the minimum without the proper knowledge of any of these. Repertory is a link between collection of symptoms in Materia Medica and simillimum, which is supported by the philosophical background of Organon. Therefore, to be a successful and a classical homeopath, one must learn and master these three disciplines, that is homeopathic Materia Medica, Organon and Repertory. They are complementary to each other. In other words, repertory is a bridge supported by a philosophical background of Organon to reach a simillimum from among the mountains full of symptoms of Materia Medica. Now we will see the few quotes. Repertory growth is slow and delayed. Repertory can't replace Materia Medica. Repertory is a bridge between Materia Medica and clinical data. Repertory is an index to Materia Medica. Repertory is mean and not an end in itself. Repertory is condensed knowledge of homeopathic Materia Medica. Application of Materia Medica is done by reperturization of bedside or at bedside. Repertory lags behind Materia Medica. Source of repertory is Materia Medica. Repertory suggests and Materia Medica decides. Repertory is at your fingertips. Repertory is always superior to Materia Medica. Repertory gives options and not the drugs. Repertory is tool or method and is always impartial when the Materia Medica can't be memorized. Repertory is useful for differentiation of drugs, comparison of drugs, then elimination of prejudices. Repertory is a bridge on which the physician can travel from a world of homeopathic Materia Medica to the world of clinical medicine. If repertory is tool, you must be thoroughly acquainted with it. You must use the right technique. Practice that means constant use of repertory. Repertory is a good servant but a mad master. A case determines the selection of reperturization, and in the case symptoms will decide. Reperturization is like a fisherman's net. Reperturization is like a menu card. Final selection of reperturization depends on type of case. Repertory is a mean and not an end in itself. Final court of appeal is Materia Medica. So today we have seen the relation between repertory, Materia Medica and Organon. You must know all these things separately as well as completely, and you should know how they are intermingled, interlinked and complementary to each other. Thank you.